Hi guys, welcome back to this channel on women's health awareness. And the previous video I had spoken to you about breast self-examination, which should be done once a month after your period, and it should be done in a proper systematic way so that if there is any kind of a problem in the breast, we can pick it up. Now, there is something which you must have heard about, and that is called screening mammography. So, we get a lot of questions. Doctor, I had a family history of breast cancer, my aunt had breast cancer, or somebody will say my grandmother had breast cancer, and they are very scared, whether I will also get that breast cancer. So, breast cancer in 40 to 50% of cases is sometimes genetically related. It could be hereditary because there are certain genes which are called BRCA genes, by which the cancer of the breast, cancer of the ovary, and if you have male members having cancer of pancreas or cancer of the stomach, cancer of the colon, so these all could be related in different ways. So not only if there is a family history of breast cancer or other kinds of intestinal cancers in the family, even for women who have no history of any kind of cancer in the family, the international guidelines which are followed all across the world, especially in the US or in the UK, a screening mammogram is what is advised for women who are 40 and above. That means screening mammogram means, so the word mammogram, the moment you tell somebody, they will think that it is a very painful process and I don't want to get it done because I don't have any problem. So when we say screening mammogram, it means that we want to rule out that you have any kind of problem. And in a mammogram, just like we have x-ray, it's a detailed x-ray or a detailed kind of an imaging of each breast, which is done in a very detailed manner, so that we are able to understand the architecture, we are able to understand what is the problem in the breast, or if there is no problem, then we give a normal report and you can be 99% reassured that there is no cancer, especially when it is done regularly after the age of 40. That is what the recommendation is internationally, that after the age of 40 you need to do a mammogram once every 2 years, and then after the age of 50 ideally you should do it every year. So mammogram is important. Why we need to do it is because if you have a family history of breast cancer, if there is a risk that 40 to 50%, there is a risk that you could be getting this breast cancer, a regular screening will help us. If there is a breast cancer developing, we are able to pick it up at an earlier stage. When you pick up a breast cancer at an earlier stage, you can give a definitive treatment. Sometimes when it is very early, it is very small in size, say less than 0.5 centimeters, there is no need actually to remove the entire breast, which is called mastectomy. Only that particular tumor or that particular portion where there is a breast cancer developing is removed with a tumor-free margin. So that is called lumpectomy. So the earlier you diagnose, your treatment is going to be easier, your treatment is going to be simpler, you may not need chemotherapy, you may have an almost 100% or full recovery. So that is the reason why, and unless we do a mammogram for screening for everybody, we may not be able to pick out cases which are in very, very early stages. So only a mammogram can pick up any kind of a tumor or problem which is at a very early stage. But that doesn't mean that if your mammogram is normal, then 100% there is no chance, because sometimes, very rarely, there could be cases which are inside the duct and then a mammogram may miss it. But mostly 99%, a normal mammogram means that the report is normal, and you can be rest assured that for the next 1 year or 2 years, you don't have to worry about the breast cancer. Another important thing is that women worry about, how am I going to do the breast mammogram, who is going to be there, who will see me. So they feel shy, they feel very awkward, they don't even want to talk about a breast examination. So we did speak in the previous video about a breast self-examination which women should do. that is every month, especially after the period, and even postmenopausal women can fix a day of the month when if they're not getting their periods also, one day of the month they can actually do a systematic thorough breast self-examination so that anything which is a problem in the early stages can be picked up. About the mammogram, women have this myth that it is going to be very painful. I don't want to, a chest x-ray, at least I'm wearing a gown. But in the mammogram, are you going to do a examination of the breast, and is it going to be an x-ray? So do understand that in most hospitals, the mammograms which are available are very high quality. Digital mammograms are there. And usually you will have a female nurse who will be accompanying you. And because of the process by which the breast actually has to be visualized properly, it is definitely not painful. Maybe sometimes you are going with the fear, and with that fear of it will be painful, or you are having a little bit of a fullness in the breast or some kind of fluid retention, so you may think that it is painful. It may be uncomfortable for maybe a few minutes, like even pap smear women are scared about, but trust me, mammograms which are done by trained professionals in a proper setting are not painful at all. And that is something that is so important, that when you do your mammogram, you also pass on the same information to other women so that they are not discouraged from doing a mammogram just because of the fear of pain. Another fear is that I don't want to do the mammogram because it is a lot of radiation. So in our normal environment, because we are surrounded with cell phone, we are surrounded with Wi-Fi all the places, the radiation which comes from our environment actually is almost equal to one chest x-ray in a week or in 12 days or 10 days time. And that is the same amount of radiation that is going in for a mammogram. So in fact much less than that. So it is much less than or almost equal to that of a chest x-ray, and it is quite equivalent to your natural radiation which you get throughout the year all the time. So mammogram is safe. Mammogram does not mean you'll get a lot of radiation. If you pick up something abnormal, the mammogram, you will really thank your stars that even if it's a cancer, it's not that your life is over. The breast cancer, when it is detected early, when it is treated by the proper person to treat, the outcome and the 5-year survival is really good. And it is better that if there is a problem which is going to happen, because we don't know who is going to get this problem, when you have done the mammogram, you are at top of the situation. You can at least be tension free for a year or 2 years till you do your annual and once in 2 years mammogram. So repeating again, myths about the mammogram are many. And if you look at the color behind me, it is pink, and this is October. So please remember Pink October. At least get your mammogram done every October, or because this is the month when a lot of festivals come. Remember that every month, every year when it is either Durga Puja or when it is Diwali time, I will also get my mammogram done so that you are staying safe and you are also able to pick up any kind of problem which is there at an earlier stage. So do take care and share this video or share this information with friends you know, so that especially if they are more than the age of 40 and they are so hesitant to do a mammogram, encourage them to do so. Women who have a family history of a breast cancer or a family history of other inherited cancers, we encourage them even from the age of 30 or even 35, they can actually start doing the once in a year mammogram, so that if there is a problem because of the inherited gene, we are able to pick it up earlier and give them a definitive treatment. So do take care, women. Along with the breast self-examination, don't forget, if you are more than 40, your annual or once in 2 years mammogram is due, and go for it. Thank you.